Can everybody see the screen and the slides?
Yes.
Okay, perfect. Yeah, thank you very much for giving us the opportunity to present our solution to you. Today, I would like to introduce to you the Tidewave turning mattress, and our company, Tidewave R&D, is located in Norway. We're established 2017, and the product that I'm presenting to you is covering one big problem. And it is, the turning of patients, which is always connected with pressure ulcers. So I know that most of you know the problem connected to this, which is on the patient side, that the patients, they are depending on frequent repositioning. Usually that's performed every 2 hours by 2 nurses. And it is very sleep disruptive and undignified in many cases because it's connected with pain. There's risk of more injuries when moving manually the patients. And especially, since this has to happen nearly every 2 hours, day and night, that's a problem, of course, for the sleep. On the caregiver side and nurse side, it's, it means heavy lifting, it's time-consuming work, and it's one of the highest risks of actually receiving work-related injuries. On the institution side, it's high treatment cost. The treatment of pressure ulcers is much higher than the prevention, but still there are many cases where there are incidents in institutions, and it is a resource-intensive work that has to be done to prevent pressure ulcers. So this is the problem, and it's a burden of manual turning. We have developed the Tidewave turning mattress, to lift that burden and have an automated pressure relief with continuous repositioning. And the way it works is it builds a unique curved shape for more pressure distribution, and then it provides pressure relief through a 30-degree side positioning. That means it prevents and also can be used for pressure ulcers up to and including grade 4, which is the highest degree of pressure ulcers. We do have a demo video to show you how it actually works, but please note it is fast forward, and in reality, the movements that you will see here, they're much slower. So you see that we start by building up a curved shape, which is kind of a U form, and then we have very slow movements from one side to another, from left to right, and this can go up to a 30-degree angle. And when we then look at the patient benefits, so here we really put a focus on increased quality of life and empowerment of the patients. So in terms of sleep, there's no sleep disruption. So when you use it during the day or the night, the manual repositioning is not necessary. It's automated up to a 30-degree angle. The pump unit that we have is very silent. And the product, I will show you later as well how it consists, what are the parts of it. But there is a pump unit, which is the control unit, and it's very silent. And we've seen that sleep is a very important factor for healing. I hope I'm not talking too fast, but just let me know later in the Q&A session if anything is unclear. In terms of comfort, we have a poly or PU foam mattress. It's ergonomically shaped and adapted to the body of the patient when we build up the curve. And then we have the very slow and unnoticeable movements. So there's continuous movement, and it's so slow that, the patients, they barely recognize that they are getting moved. And we have a breathable hygiene cover all around. In terms of safety, one big aspect is the U shape that we built, which is reducing friction or shear forces. So you are kept in one place while you're getting turned. And this is also the U shape, reducing the risk of falling out of bed because you're centered and it's almost like in a cradle. We do have an emergency CPR button, and I show you here now. This is how the product looks like. And in terms of sleep, you see this is the control unit where the pump is inside, which is very silent. And you see here that you do have on the upper part, the foam mattress, in the lower part, there are air cells. And because you're really tucked in and the movements are very slow, you can have good sleep because manual repositioning will not be necessary. Here you can see the foam mattress. It's customized for our product. In the upper part, you also see the yellow part, which is the harder edge to make it easier to get in and out of bed. And the kind of red part down here is actually cut alongside so that we're supporting the U shape that we're creating. And then you also see the hygiene cover, which is all around the mattress. It also gives additional safety for any fluids, so patients can be washed in bed. And yeah, it's protected since there's also kind of this flap over the zippers. In terms of safety, if there is an emergency where CPR needs to be performed, you see here is a CPR quick connector with a red push button. So in case of emergency, the air hoses can be disconnected and the mattress will deflate in less than a minute so that CPR can be performed. I would like to show you the settings that we have available. It's customized care settings so that we can cover the patient's needs, but it has also been developed according to clinical best practices and in mind the user, which in that case is the nurse, so that it is intuitive and easy to handle. So the moment you press the start button, it will provide continuous turning cycles. So there are no periodic movements or repositioning. It is happening 24/7 constantly. Then you can choose the turning degree, which can be a 10, 20, and 30 degree repositioning. And you can choose the direction of turning. So it could either be going to the left, to the right, or you see in the standard program, it's chosen both directions. Another option is delay on each side. What that means is if the patient is turned fully to one side, then there can be a 30-minute pause on that side, 15 minutes, or continuous movement without any pause. With the turning speed, you can choose how fast, but saying fast, it's still very slow because the fastest speed is about 20 minutes to be repositioning from one side to the other, 40 minutes or 1 hour. We have also the care function. The care function, if you press the start pause button, then you have a 30-minute pause where the mattress deflates. And that's a good time to do patient care. If the patient needs to get out of bed, it's necessary that it deflates. And then after 30 minutes, it will resume. So it continues the program automatically. And you don't need to remember to press anything because that's very important in a very busy everyday work life, that it's easy and it continues automatically. We do have sensors in the mattress. So these sensors, they are there to assure the 30-degree repositioning, but also to detect if the headrest is lifted or the backboard is lifted more than 30 degrees. For instance, if there is a meal that the patient wants to take, they can sit upright with our mattress, but it is very important for safety aspects that the turning program stops. So the moment it is above 30 degrees, the sensors detect and then the program will stop running, the mattress will deflate. But of course, you still have the 15-centimeter high foam mattress. So they sit very comfortably on the foam mattress, but there is no turning program running. The moment the backboard is lowered below 30 degrees, it will also resume automatically. So it's a very smart product that you don't need to remember to press any buttons, and you can just be assured that the patient receives the care necessary. I would like to give one example on which settings, or actually two examples, which settings are best chosen in different circumstances. And one of the most common areas where pressure ulcers develop is the sacrum, so on the spine. And there you would want to reduce the time the person actually stays on the back. So you would choose a turning program which is moving in both directions with the highest turning angle, so that when you turn, you're laying mostly on the soft tissue, 30-degree repositioning. And you want to spend most time on that side, so 30 minutes delay. And when you're turned, then you want to reduce the time that you're spending on the back. Then we also have a case, for instance, if one person should only be turned into one direction because of a hip surgery, there could be partial burns on one side, there could be broken limbs, then you can choose to only turn to the left or only to the right direction. Now, when we look at the side of the nurse and the caregiver, we really want to empower them as well. And we have a very simple calculation here, which, I mean, you as experts, you know the best how much time it actually takes you to reposition one patient. So if we assume there's one patient, which according to clinical guidelines would actually receive, in the best case, 12 repositionings per day, every 2 hours. In reality, during night shifts, that's usually, at least here in Norway, not what is happening, but that's the best case. So 12 repositionings per day performed by 2 nurses. And let's say you do it really fast, 5 minutes per repositioning, then you actually save 168 heavy lifts and 14 hours in just 1 week for one patient. That doesn't mean that the patient wouldn't require patient care, but what we really focus on is customized, constant, and standardized patient outcome. So you have more care time, and therefore we improve productivity. The product is very easy to install and use. The cleaning procedures are simple. You can use just a cloth with alcohol and clean it, or you can remove the incontinence sheet or hygiene cover, and it's machine washable. There's no assistant needed while the turning program is running. So up to a 30-degree, the patient is automatically repositioned and it gives actual pressure relief. There's no interruption in the workflow. And we're also improving the safety aspect for nurses. So there's no heavy lifting and therefore reduction of work-related injuries. We have seen that with the product used, there will be actually up to a 15% productivity improvement. So now we're not the first product on the market. There are products which are in today's use already. Most common ones are just simple foam mattresses, which are for pressure relief where they can sink in. You have alternating, you have alternating air mattresses and you have turning systems. But what we want to focus on is to really fill the gap in the market and have innovation, user friendliness, and clinical impact. And what we mean by clinical impact is that we have developed the product according to international guidelines for pressure ulcer prevention. And 5 aspects which we have a big focus on is pressure distribution on the body, relieving existing ulcers, up to a 30-degree repositioning, the avoidance of friction to the skin, and the avoidance of shear forces. Now, if we take a closer look to what that actually means from a clinical aspects, I don't really need to explain to you how manual repositioning can be challenging, but just to mention a couple of aspects, it's difficult to actually measure the angle if it is 30 degrees. And then when you use pillows, it can be that it's not actual 30 degrees, that the patient is pressing it more down. So it's a smaller angle, there can be friction, there can actually be shear forces, and it's still time consuming and includes heavy lifting. So with traditional turning systems, what we've seen here is it's mainly a flat surface. So, and then it can be that one side is lifted up to a 30-degree angle, but when it's a flat surface, what you create is actually a slide. So it's almost like you're having a higher risk of sliding down. And when you're sliding down, you're reducing the actual angle. So it's not 30 degrees anymore, it's less. And you have friction, shear forces to the skin, increased pressure on the sacrum. So the sacrum isn't relieved of pressure, and you have actually the risk of falling out of bed. And then, since most of these turning systems, they repeat the movement. So they increase on one side, reduce, increase, you have repeated risk as well. Repeated movement means repeated risk of all these factors. So the difference with our product is we're building up the curved shape once at the beginning. It's adapted ergonomically to the body. You don't need to type in any patient weight or size. The sensors will detect everything automatically. And then you have, with the curved shape, an increased pressure distribution. So there's a bigger contact area between the body and the mattress. And then we provide the slow movement. So you have, with the shape, less pressure on the sacrum. You have support on the sides, which is reducing, kind of like friction and shear forces. And it's according to best practices. And EPUAP stands for European Pressure Ulcer Advisory Panel, which kind of like was giving those guidelines. On a technical aspect, when we then look at the different solutions, alternating air mattresses, turning beds, and turning systems, there we see that here you still don't have a foam mattress included in this product. So you would need one below in case there is a power outage, that the patient doesn't lay on the bed frame. There is no turning automation. You still would need to do the manual turning, and there's no pressure relief when the program is off or there's power loss. It's a reduced contact area. What that means is increasing and decreasing the pressure by air cells means less contact area actually, and you're increasing when you reduce it somewhere. You have also most of the time quite a bit of noise coming from the pump units. In a turning bed, it's very complex to operate. There are some abrupt movements. It's mainly used in ICU, so it's not wildly adapted or can be used everywhere. And it's a very expensive product. Compared to the turning system, here you would also place it under a mattress. So you would need to have any type of mattress on top, where then you cannot guarantee how does this mattress kind of affect the movement. Is it a hard foam mattress, a soft foam mattress? And that can affect the outcome actually. There's no continuous turning, it's mainly periodic, and you have the repeated movement, which we have seen in the previous slide. And there's no shutdown in risk situations. Here with our product, you kind of see all the technical aspects that I've mentioned before as well. It's one mattress replacement system, so it's an all-in-one solution. There's continuous repositioning 24/7, and we have slow movements with a silent pump. It's adapted to the patient's body and need, and there are sensors included in the mattress, and those are for safety and accuracy. The technology is actually patent protected, so we have filed a patent for it. And the main aspect is the unique and ergonomic curved U shape, which these other solutions don't have. When we look at the pathway for the product, we've seen that it can be used in almost all healthcare settings, in hospitals, in all these different areas with specialist clinics, for instance, spinal cord injuries. We have had dementia patients, can be used in trauma, geriatrics, neurology, intensive care. And also in long-term care, we see that it's necessary to be used in rehabilitation centers, in nursing homes. And we had actually one case where, Anna-Sophia was one patient that was admitted after a hip surgery to a rehabilitation center. And there she used the Tidewave mattress where she would only be turned to one side. But then when she was released and was living at home, she would have needed an ambulatory care service to come at home and help her getting turned during the night. So here she took the mattress home and was using it at home by herself and was not in the need of having the home care service come and turn her during the night. And yeah, today in Norway, we are also providing the product to home care and people living at home. But this is kind of like one pathway how it can be going. Then I would like to give 3 examples for all those settings. In a nursing home, we had one case where there was a patient with dementia, and unfortunately he had a pressure ulcer stage 4. It was an 8 centimeter open wound down to the bone. And the problem here was that because of the dementia, he was very confused and he couldn't understand why the caregivers would come during the night and try turning him. So he resisted, and yeah, it was not a very good experience for neither the caregivers nor the patient. So when they then used the Tidewave mattress, they could actually see that the wound started to heal. And that was one of the reasons that he could rest. There was no additional friction, no movement given to the wound. And the rest was critical for the healing, for both like the patient, but also the wound. In a hospital setting, we had a head surgery patient. So after the surgery, it was very important that there was no abrupt movement to the head. There was no pressure ulcer developed, but he was at risk of developing one. So with our solution, we have provided continuous pressure redistribution. There was no abrupt movement to the head, no pressure ulcer occurred during the time, and good sleep has been reported. In a home care setting, we had a child with CP, and the problem there was that it had severe sleeping issues. It required a parent to co-sleep every single night with her in bed. So the first time the child was actually sleeping well alone. So there was no parent needed when the Tidewave mattress was introduced, because there was also no manual repositioning needed during the night. So it was a very big relief for the entire family, for not just the child, but also the parents. We're continuously working also together with institutions to kind of like work on more data and proof for our product. And right now we're having a clinical trial with Synos Sykehus. It's a rehabilitation hospital, which is specialized into that, and there we are in the spinal cord injury department, and it's one of Norway's largest specialist hospitals. In Germany, we're working in autumn together with also a geriatric medicine facility which belongs to Charité in Berlin. And yeah, so that's kind of like how we're building also more proof how our product works in different settings. One was spinal cord injury. Now another one is geriatrics. I would also like to give you a live demo. I have the product here right behind me. And I'm gonna stop share now and change the camera so that you can see a different angle, right?
Yep. You see that?
Okay, so first of all, we do have zippers here where you can then open up and kind of see how it really looks. And you see here the slices. I mean, it's a little bit difficult since the camera isn't too close, but it's very easy to really open up with the zippers and close it again. I have lowered the bed rails down so that you can actually see the movement. The settings that we have chosen is a 30-degree angle. And you can see here, hopefully on that side, maybe a little bit, but there is a curved shape. So now if we have somebody laying in bed, you can see it a little bit better, but right now I only have a bit of weight in the middle here. But yeah, maybe you can also see it here. So there is a curve which is built, and then you see how fast it's moving. No, because you shouldn't see any movement. It's very slow. So the turning speed we have chosen is the standard setting, which is then about 40 minutes. Another function that I would like to show you is with the backrest, we can lift it up. And you won't see it because I guess the light isn't really well. But what is happening is that now here's a red light on because the sensors, they have detected that the headrest is lifted above 30 degrees. So now there is the air going out of the mattress. And the moment I'm actually lowering it below 30 degrees, this is already below 30 degrees. So you see it is still quite high up, but then the mattress just resumes again and the light is off. So I'm just lowering it down. So, and the last that I would like to show you, and just to be quick and time efficient, I'm gonna change camera again. So now you should see the control unit. And here we have the CPR quick connector. So in case of an emergency, you simply press this button and you disconnect. So then you can feel and hear the air coming out and the mattress is deflating quickly. So here I can then also see that there is a red light on, which is the service light, which indicates that the product isn't running. The moment I'm connecting it again, you should hear a click. There's a click, and then it is connected. The mattress will then calibrate and the service light is off. And then it just continues again. So I would like to go back to my slides. And I'm ready for the Q&As that you might have.
Thank you, Daniela. So now we are into Q&A session. You can actually type it onto the chat, or you can just unmute yourself and ask the question. So we do have a question coming in already from Diana at SKH. What is the total height of the mattress? That means probably the thickness of the mattress.
Yeah, so it is 17 centimeters when it is not inflated. We have kind of like 15 centimeter foam mattress and then the air cells. So what you have here is that in the top part, there is the foam mattress, and in the lower part, you have air cells, which there are two parts, air cells which create the curve and air cells which do the turning direction or the turning movement. And it depends a little bit on the height. When it is fully turned to one side, then you need to see with the patient weight in there, it varies a little bit. But I hope, it's according to the standards that I used. And I hope that is answering your question.
There's a question from Manfred. Hi, what kind of pressure ulcers has the Tidewave been tested on?
It has been tested on all grades, which is no existing one, grade 1, 2, 3, and 4, and then different areas where we had pressure ulcers. For instance, sacrum. Patients also had it on heels, which is a very common area. And there we actually, how do you say it? We recommend that there is pillows used for the heel, so that you put pillows between the angles. Since you're turning, there should be some cushioning in between and also below. And the advantage is that when the curve is built, those pillows, they will not be moving. So you position it once and then they're kind of tucked in.
Technically in Singapore, we actually have this kind of foam where we kind of wrap it around the heels. Yeah.
Yes.
So there's another question from Manfred. So is this a preventive or is this a therapeutic kind of advice?
So in the first line, it's preventive. For therapeutic, we would say there is still the need for wound care if there are existing pressure ulcers, but it can be used when there are pressure ulcers already, because one part of the healing process is providing movement. But it's very clear that there's still nursing required for the wound dressing and the treatment of the actual wound. So that cannot be taken over by the mattress, but it can be used for all grades.
So Diana has another question here. For preventive, has there been any studies that has been done to show that the reduction in the development of pressure ulcer injuries?
So as I said before, we're currently working on studies. What has been done previously is pilot projects. So it wasn't kind of a long-term quantitative study, because that would actually take years to kind of prove that with the mattress, you are reducing XYZ%. But according to what's actually in the clinical guidelines, it is following all the advice given. And one big point is the movement that you're providing. But no, and in that sense, we do not have a study which says XYZ% reduction. But if that's of interest, it's definitely something we're happy to collaborate, of course. Exclusion criteria is the next question I can see.
Yeah, that's right.
So I would like to say that we do have actually two versions of the mattress. We do have one for adults, which has a weight recommendation from 40 up to 150 kilos. And then we have a children junior version of it, where we can have it below 40 degrees. So that would be for the adult version an exclusion criteria. If it's below 40 kilos that the patient weighs, then we can offer a children version, but then it's also a smaller size. So I guess that's answering the two questions with exclusion criteria and weight limit. And one more aspect is, of course, it should be patients which are in the need of manual turning. So mainly immobile patients that have no own their own movement. The next question, I'm not sure what plane means. Plane of repositioning.
Hello, maybe Manfred here. Hi.
Hi.
Yeah, maybe I just verbalize the questions. So it only moves in one plane, right? That means tilts left and right. It doesn't tilt forward and backward. Am I correct?
No, that's correct. It's lateral rotation, left and right. It doesn't do up forward and down, kind of like in that sense.
Okay, thank you.
You're welcome. Yeah.
Okay, there's one more.
So the solution that I have shown you right now, it's an all-in-one solution. So you would replace any existing mattress that you have, so foam mattress or air mattress, and use our product. And the reason for that is that we can assure that, we know exactly how it works. But we do have three options for foam hardness. So we have soft, medium, and hard foam that can be chosen. But it is required because we're having it customized with the lateral slices and the hard edge, so that it's really perfect for our product. And we do not recommend to have any product under or over. So no additional alternating mattress or no additional foam mattress. it's really nice to receive all these questions. So I appreciate it to see that, yeah, there is still things that I, can be mentioning, which is of interest to you. So that's great to see.
Yeah, I think bed turning is a very big, still a very big issue. Although, like you mentioned, that there are solutions out there, but I think this is a very unique way of approaching the problem with a curvature and also a continuous. And I think it's also 100% free of any intervention from the staff. So, okay, one more question.
With contractures, do you mean spasms?
More like the patient can't really lie flat, can't really lie on their back, can't really lie supine, like they are basically curled up.
Spinal issue, yeah.
Could be spinal issues, could be just generally very old patients, that don't move a lot.
Yeah, so we're doing that currently with the spinal cord injury patient group that we're testing. So all of those, they are either coming because of an accident, or they have these, how do you say it, not symptoms, but the condition already. And we've seen that even if they have a very kind of like, the spine is very different, it's not straight, and they might not be able to turn the legs or have them straight, it still works. And we have done that we've tested it, but we've also have now in Norway sales to those type of patients, and yes, it is fine with them. And it's actually kind of like, because at the beginning, when we build up the ergonomic shape, you always will have the patient laying on the mattress before you start it up, and then it's kind of like inflating around them and how the body is kind of shaped, so it has an ergonomic effect. And another question is, if the air cell mattress is spoiled, can it be changed independently without removing the foam mattress? Yes, so the main parts that the product consists of is the control unit, which can be exchanged. It's the hygiene cover, which can be replaced. It is the foam mattress, which is replaceable. There we recommend, actually, I mean, no foam mattress should be used longer than 10 years anyway. So it should be regularly, like 5 years is usually what is recommended to exchange foam mattresses. But yeah, so that's definitely all these different parts, they can be replaced. So, but yeah, in general, to answer the question, if the air mattress is spoiled, if that can be changed. So it's more common actually that before anything is going wrong with air cells, you would change the foam mattress. You're welcome. But it's a good question, because I did not mention kind of like how easy it is to, kind of like change it if there's any requirement for it. So thank you for that. Is there any contact? Yeah, so actually what I also would like to show you is, I need to move that to the side. We will have together with Knee Care a product for you available in Singapore. So in case you're interested to see the product yourself, you can just contact me directly, or of course Knee Care, since he's located in Singapore, and we're happy to give you a pilot or a demo, and you can either go to him, or I'm sure Knee Care is also happy to facilitate it with you in the way that's most convenient to you.
Yeah, so we'll be bringing demo sets here into Singapore. So for those who want to look at it or even want to test it, you can actually bring it down to your hospital as well for you to try out. And I believe some of you might even want to do some pressure measurement to ensure that the effect is effective. Yeah.
So
Okay.
nearest date available for demo. Well,
is it on the plane already?
Yeah, so it's super nice that we see there's so much interest. I'm sorry to say that you might need to wait until July because we're just in the process now to actually get the shipping done to KneeCare. So I would say that by July, KneeCare will have the demo unit with him. And then from July onwards, it's available for demo. Yeah. I think it's also really nice if we still have a bit of time to kind of like, if you feel like it, to hear your feedback as well, what you think about the solution compared to maybe others that you have tested already, or if you kind of like see the difference from our product. So that's free to you if you would like to have a dialogue a little bit.
Yeah, feel free to unmute yourself. I believe many of our nurses have tried a lot of bed turning, ranging from a bed that turn by itself, like the Huron high-end bed turning for ICU, and also the total bed turning system that we place it underneath the mattress, and of course the traditional air mattresses has been done as well. Yeah. So anybody who has used that and will want to share your challenges or the limitation that you are still facing, and we can actually share whether this new solution will actually resolve that issue that you're facing now.
Also, what is to mention, I mean, throughout the development phase, it was very important to actually have both sides giving us the feedback. So the patient side, so that we cover really their needs, but also the caregiver, the nurse side, because the worst, that you can actually have is a product which is not easy to understand, which is not easy to operate. And yeah, so just to share with you a little bit of the development, we had actually a different panel here. So this was a touch panel, but then we realized that in the everyday work, having a touch panel is not good when you're wearing gloves. So, and then to have it more simple with just push buttons where you press just here and then it changes the setting, that's much easier. And the less you kind of like have to put in yourself, the less can go wrong in a sense. So it should be almost, as simple to use as a washing machine where everybody knows like, okay, I press start and I choose the program and then I can be sure it's running.
Well, also one thing I think Daniela, you also mentioned that you have released the children version, right? Which I think there are not many, or in fact no solution for small size bed turning system in the market at all. So this will be very appropriate for KKH, which is our children and children hospital in Singapore.
Yeah, we have actually released, or the product release was it the 31st of May, and we have already received orders, but just because we're now selling the product, we have had the product since 2018 in pilot testing with children. So it's been a good time where we have tested, and just before the product release, our distribution partner here in Norway, they have also really worked on the testing with children, and the feedback was very, very good that we received. So yeah, it's available for children as well. There was
a question from Diana. So Diana, sorry, it's because we are recording this session and we'll be sharing on YouTube. So we won't be able to talk about cost in this recording, but we can take it offline. I can arrange a separate session with Daniela and you. then we can talk about the cost that work out for both parties. And I think Maxine has a question as well.
But I would also like to mention that we are flexible when it comes to kind of the structure, if it's OPEX or CAPEX or a hybrid solution. So that's kind of like also depending on what's easiest for you to have it kind of a budget that you're investing in, or you have kind of like the operating costs.
The warmer.
Yeah, I'm not sure what that is.
It's a warming blanket. It's a warming blanket. So if I may say, because I'm a PME head before, the bear hugger should not have any impact because it's placed on top of the patient. It's a warm blanket. So
just on top, not below?
No.
Yeah, but even if it's kind of a below one, which is just like a flat surface, we have used kind of like pressure picturing mats on the mattress, which it doesn't affect as long as it is kind of like almost like fabric and soft and movable. Of course, that can be used. So normal bed covers on top of our product is of course no problem. And on top of the patient, normal blanket or these bear hugger, they can also be used. Should not be affecting. What kind of cleaning solutions are recommended for cleaning the cover? So you can either use a wet cloth with alcohol and then wipe it, or you can remove the entire hygiene cover, and it is machine washable up to 70 degrees. So both options are possible.
I trust with the cover, because in Singapore normally we do have kind of standard chemical that we use to clean the bed after every patient use. So we can actually test those chemicals on the cover that we already have. I trust that it should be able to take care of those chemicals. Yeah.
Yes.
And then if Daniela, if you do have a list of cleaning solutions that are able to be used on the cover, I think that will be good information as well.
I think we don't have a list. We just have general information with kind of like the percentage of alcohol in it. But it's a very durable cover, so it shouldn't be very sensitive to the cleaning material. But I can ask my colleagues. So I'll just take a note and actually see if they might be able to provide a list. But Nikia, you can maybe just tell me as well what solution is very common in Singapore.
Yeah, I can read out my own notes.
Yeah.
Okay, there's another question here. Is it waterproof? I trust it is. You mentioned about washing, right? Just now. Is it waterproof?
So for incontinence, it is waterproof in that sense. And also the patient can be washed in bed. So you saw that we have the cover going over the zippers. So that's kind of like splash proof as well. So it is waterproof, yes.
Okay, I think we're running out of time.
You're welcome.
So not to worry. The audience can always still continue to send me questions, and I can follow up with Daniela on the answer. Let me share my screen so you can get my information here. So you can see my screen?
Yes.
Okay, so if you want to follow up with information, like some of you are asking for demo, some are asking for price, please drop me an email so I can follow up closely with you individually. So this is my email address. I believe quite a number of you have it. I was the one who sent the login information to you as well. So just to share, tomorrow there will be another session where we have roommate, contactless sensors for fall prevention, Sonita, a real-time positioning monitoring system, and Hubert, tablets for shared use. So these are the session tomorrow. Hope to see you guys tomorrow as well. So just remember, you can continue to send me questions and I'll follow up closely with you. Thank you.
Thank you very much.